Have you heard that holding your semen for a long time can boost your energy, your testosterone, and even your sexual strength? Well, that's one of the biggest myths on the internet, and also one of the most dangerous. What many men don't realize is that the body wasn't built to function under repression. Semen isn't a poison to be contained, nor a magical energy that accumulates. It's part of a delicate biological process, and when you hold it for too long, you're directly interfering with your hormonal balance and the health of your penis. Pleasure, erection, libido, all of this depends on a hormonal system in harmony. When a man decides to retain semen for long periods, the body enters adaptation mode. The brain understands there's no release and starts adjusting the production of sperm and hormones like testosterone and prolactin. In the first few days, there may even be a slight increase in energy and focus, but as time goes on, the body starts charging the price. The buildup leads to tension, anxiety, and in some cases, real physical discomfort. I see this every day in my practice, men who arrive believing they are practicing self-control when, in fact, they're overloading the body. They report irritability, trouble concentrating, and even less firm erections. And do you know why? Because holding semen for too long doesn't strengthen the penis, it weakens it. Excessive retention alters pelvic circulation and can cause prostatic congestion, a silent inflammation that reduces sensitivity and harms erectile function over time. The body is intelligent. It was designed to balance production and release. When you try to hold in what needs to come out, the body reacts. Sometimes that release happens involuntarily during sleep, the so-called nocturnal emissions. It's the body's natural way of protecting itself. Extreme retention, on the other hand, confuses this system, messes with dopamine and testosterone, and can turn what should be vital energy into frustration and fatigue. The problem isn't holding for a few days, but believing that this should be a lifestyle. Balance is what truly matters. Semen isn't something that needs to be repressed, but understood. And understanding how it works is the first step toward real control over your body and your pleasure. Semen is a complex biological fluid composed not only of sperm but also of essential proteins, enzymes, vitamins, and minerals. It is produced mainly by the seminal vesicles and the prostate, and this entire process is controlled by a delicate hormonal balance. Each drop represents the synchronized work of many parts of the body, brain, glands, and reproductive system. Semen production starts in the brain. That's where the hypothalamus and pituitary send commands to the testicles, stimulating the production of testosterone and sperm. This cycle works like a biological clock. The body produces, stores, and at a certain point, needs to release. When a man ejaculates, it's not just a physical outflow of fluid, there's a chemical and emotional release as well. The brain eases tension, stabilizes dopamine levels, and releases prolactin, the hormone responsible for the feeling of relaxation after orgasm. Now, when that release doesn't happen for a long time, the body has to adapt. Excess accumulated semen increases pressure in the glands, especially the prostate. It's like a reservoir that's never emptied. The body tries to reabsorb part of that material, which costs energy and can alter hormonal balance. Now that you understand semen's real role and how the body handles it's time to see what happens when you decide to hold it for days or weeks, and how that choice directly affects your erection, your hormones, and your sexual health in a silent way. When a man decides to hold semen for days or even weeks, a series of silent reactions begins inside the body. In the first few days, the system handles retention well. The brain still sends signals for normal sperm production, and the body maintains hormonal balance. Many men report feeling more energy, focus, and vitality, and that happens because testosterone temporarily accumulates when there's no immediate release. But that effect is short-lived. Over time, the body notices it's producing more than it's using, and that's when the changes begin. Excess stored semen increases internal pressure in the reproductive system. The seminal vesicles and the prostate start getting full, and the body tries to reabsorb part of that fluid. This process requires energy and alters how the body regulates hormones like testosterone and prolactin. The brain, sensing the buildup, reduces hormonal stimuli to restore balance. The result is a slight drop in testosterone and, consequently, a decrease in libido. The penis, which relies on this hormone for firm erections and steady desire, starts responding differently. In addition, lack of ejaculation affects blood flow in the pelvic region. Spontaneous erections, the ones that occur during sleep or upon waking, are a natural mechanism to maintain penile health. They oxygenate the tissues and preserve elasticity in the corpora cavernosa. When a man goes too long without releasing semen, these erections tend to decrease, which can compromise local oxygenation and affect rigidity over time. There's also the psychological effect. Prolonged retention increases mental tension and irritability because the brain keeps producing dopamine and adrenaline without the natural relief that comes with ejaculation. This can cause insomnia, anxiety, and even difficulty concentrating. A man feels loaded, and that accumulated energy can turn into stress. Another important point is the impact on the prostate. When semen stays retained for long periods, the risk of prostatic congestion rises. This condition causes mild pain, pelvic discomfort, and in some cases, frequent urges to urinate. The body is simply signaling that there's excess. It's the same principle as any system that accumulates more than it eliminates. But none of this means that holding semen is always bad. The problem lies in excess. In small doses, retention can support self-control, body awareness, and even the rediscovery of pleasure. The risk appears when a man confuses control with repression. And that's exactly what we see next, how the brain and emotions react when the body is put under this prolonged tension, and what retention can do to your focus, your mood, and your mind. The body and mind are inseparable, and when a man holds semen for too long, the impact isn't just physical, it's psychological. Prolonged retention changes how the brain handles pleasure, concentration, and even emotions. In the first few days, many men report a sense of increased focus and energy. That happens because dopamine, the neurotransmitter of pleasure and motivation, begins to accumulate. Without the constant release of ejaculation, the brain channels that energy into other areas: productivity, training, creativity. And yes, this initial phase can feel great. But as days pass, the same process that seemed beneficial starts to reverse. Dopamine buildup without natural release generates mental tension. The body keeps producing sexual energy, but without a proper outlet, it turns into irritability, impatience, and anxiety. Think of a pressure cooker. The contents aren't the problem is not venting steam. A man begins to feel the weight of his own energy, and what used to be focus becomes distraction, nervousness, and in some cases, frustration. The brain also suffers from hormonal swings. Prolonged lack of sexual release can raise prolactin and cortisol, the stress hormones. That combination lowers libido, harms mood, and even interferes with sleep. Some men report mild insomnia, intense erotic dreams, or nocturnal emissions, natural mechanisms the body uses to relieve accumulated tension. The brain tries to restore balance on its own, even without your permission. The emotional aspect is just as important. Many men start retention seeking control and inner strength, but end up falling into the trap of excessive discipline. They turn self-control into repression. And repression, unlike control, breeds guilt and disconnection from one's own pleasure. When desire is constantly restrained, it stops being an ally and starts being seen as an enemy. That's when retention stops strengthening you and starts draining you. Once again, balance is the key. A man who manages his sexual energy without extremes experiences the best of both worlds, focus and vitality without losing lightness and pleasure. When you understand that semen doesn't need to be wasted or imprisoned, but respected, body and mind fall into harmony. But there's a critical point at which the body starts sending clear signs that you've crossed the line. It's when control turns into suffering. Pain, discomfort, loss of sensitivity, All of this is your body asking to return to balance. Next, I'll show you exactly when retention stops being healthy and starts affecting your hormones and erection in a dangerous way. Everything in biology has a limit. When a man goes beyond that limit, the body sends increasingly clear signals that something is wrong. Holding semen for a few days can be beneficial. It helps strengthen self-control and can even temporarily increase desire. But when retention stretches into weeks, the body stops interpreting it as discipline and starts seeing it as blockage. The result is the accumulation of physical and hormonal tension. A system that should run in harmony begins to work against the man himself. The first sign appears in the pelvic region. The seminal vesicles and the prostate, the organs responsible for storing semen, become congested. It's a silent yet constant pressure. A man feels heaviness or mild pain in the testicles, as if something were backed up. This condition is called prostatic congestion, and although it may seem harmless at first, it can evolve into inflammation, urinary discomfort, and even pain during erection. The body tries to solve the issue naturally, which is why many men who hold semen too long end up having nocturnal emissions. It's the system saying, "I need to lighten this load." Another sign is hormonal fluctuation. Testosterone, which usually remains stable, starts to swing. Without regular release, the body reduces production to balance the excess material stored. This drop isn't drastic, but enough to affect libido, mood, and erection quality. A man feels less drive, more irritability, and a subtle sense of fatigue. What used to be energy now becomes tension. Over the long term, excessive retention can also alter the pattern of spontaneous erections. They become rarer because the body tries to avoid stimuli that might lead to ejaculation. It's a defense mechanism. But fewer involuntary erections, especially at night, compromise penile oxygenation and can reduce firmness over time. It's not impotence, it's the body trying to conserve energy. And then there's the emotional factor. When a man clings to the idea that holding semen will make him stronger, he creates enormous psychological pressure. Any attempt to release becomes guilt. And guilt is poison for the mind and for pleasure. Control, which should bring freedom, turns into a prison. But it doesn't have to be this way. The male body was made to live in cycles: produce, release, recover. When that rhythm is respected, the system works beautifully. And that's what we'll talk about now: how to find the ideal balance between retention and release without harming your hormones, your erection, or your well-being. After understanding the risks of excessive retention, the inevitable question is, so what's the ideal balance? The answer lies in learning to listen to your body. The goal isn't to ejaculate every day, nor to spend long stretches repressing desire. The secret is respecting the natural rhythm of your sexual energy. The male body is smart, it shows clear signs when it's in harmony and when it's overloaded. It's up to you to read those signs. Step 1 is to observe your libido. If you feel steady desire, spontaneous erections, and stable energy, your body is balanced. But if desire fluctuates, if there's fatigue, irritability, or pelvic discomfort, it's a sign something is off-kilter, and that can be from either excess or lack of release. Self-awareness is the best tool to find the right point of adjustment. No app, diet, or guru can define what's right for you. Every body has its own rhythm. Step 2 is practicing conscious masturbation. It's the antidote to extremes. Unlike automatic masturbation, the conscious version teaches you to feel your body and control the impulse without repressing it. Use lighter touch, breathe deeply, feel each phase of arousal. Don't think only about ejaculation, think about prolonging pleasure. This practice reduces anxiety, strengthens control, and retrains the brain to handle desire in a healthy way. Lifestyle also matters. Good sleep, balanced nutrition, and regular exercise naturally regulate sex hormones. Deep sleep is when testosterone is produced in higher amounts, and physical activity improves circulation, ensuring firmer erections. The body responds to care with vitality and potency. Finally, understand that self-control isn't repression. It's not about holding semen at any cost, but deciding consciously when to release. Pleasure is part of health, not an enemy. A man who understands this reaches a different kind of power, the power to command his own energy. And that's exactly the power I want to discuss now. In the next and final step, you'll discover how to turn this balance into lasting vitality and understand that true control isn't about holding back, but about knowing yourself deeply. After everything we've discussed, you've likely realized that true masculine power isn't in holding semen for a long time, it's in understanding your body. Real control isn't about denying pleasure but mastering your own energy. A man who understands his cycles, limits, and needs learns to use pleasure in his favor, without guilt, without excess, and without repression. That's where biology and awareness meet. Semen isn't something to be feared or squandered. It's part of a natural process that reflects your body's state. Hoarding it excessively is as harmful as releasing it recklessly. The secret lies in harmony. When you find that balance, your hormones stabilize, your erections become firmer, and your mind feels lighter. You stop living at the mercy of desire, and pleasure becomes full, deep, and healthy again. I'm Dr. Emily Collins, a urologist, and I see this every day. Men who arrive believing they need to prove their strength by repressing their bodies, and leave understanding that true strength lies in allowing themselves to feel with awareness. Retention, used intelligently, teaches self-control. But when it becomes an obsession, it destroys hormonal and emotional balance. It's not about holding, it's about knowing the right moment to release. When you care for your sexual health with knowledge, everything changes. Energy rises, mood improves, and desire becomes natural again, without anxiety. Erection stops being a test and becomes a reflection of your well-being. Pleasure, lived consciously, stops being an addiction and becomes a connection with yourself. If you've made it this far, congratulations, it shows you're seeking to evolve and understand your body in a mature, intelligent way. So before you go, make sure you're subscribed to the channel, because here we talk about men's sexual health in a direct, professional, and taboo-free way. Leave a like if this video helped you see the topic differently, and comment below, balance is power. I want to know how many men are ready to live pleasure with awareness. And for those who stayed until the end, the next video is already on the screen. There I explain what happens when you ejaculate too frequently and how that affects your testosterone. Click and continue with me on this journey, because understanding your body is the first step to mastering your power.